Hey everyone, it's Tisha and Suzanne with National United Medicare Advisors. And today we're going to walk you through navigating the Medicare maze. So I'm going to turn it over to Suzanne.
Hi there. Thanks for joining us. So, as Tisha said, we are talking about navigating the Medicare maze, where we help you put the joy in the Medicare process. So, to get started, I just have three questions. Do you want to feel confident about your Medicare decisions? Do you want the peace of mind when it comes to Medicare? And do you want to make sure that you're protected from all Medicare penalties? Well, I assume your answer is yes, yes, and yes. Now, a little bit about our company here at National United Medicare Advisors, Numa. We believe that it is our God given mission to help and protect others, especially when life gets complicated. Seeing people win makes it all worthwhile to us. And we feel that it is so essential to do things right the first time. So, a little bit about our office here at Numa. We have 6 employees and we have a little over 4,000 clients that we help. And now it's almost 16 years that we've been doing Medicare insurance. So, that's just a little bit about our team. About every year, we bring in about 450 people that we help navigate the Medicare maze while putting the joy back in to the Medicare process. Now, if you haven't already received, you should be receiving in the mail very shortly a copy of my book called Navigating the Medicare Maze. And it absolutely will help you as we're making these decisions. We are designated as the official Medicare advisor for the Columbus Bar Association. That is one of my most prized endorsements because we worked so hard. And those of you that don't know what the Columbus Bar Association is, that is an association with a group of legal professionals. So we are their designated Medicare advisor. Now, a little bit more about our office here is every year I do go to Washington, D.C., where I help weigh in on Medicare legislation. So I take your stories and we talk to congressmen, congresswomen, staffers, lawmakers, because we really, I always say, our boots are on the ground. We're seeing things firsthand. So if you don't mind, I share your stories. So when we go weigh in on Medicare legislation, basically what I'm saying is these are the ways we need to work to make things better for each of the clients that are on Medicare. I was raised one of 5 kids. My dad was very passionate about helping others through the service of God. Although he was in the corporate world as well, as he could have continued to climb the corporate ladder, he would say to us children, there's 5 of us, he would say, okay, well, he's a preacher. So he would say to us, okay, kids, we're going to go ahead and move over here to XYZ state, and I'm going to help start this pastoral work. And as growing up, I really didn't understand exactly what he was doing. I just knew I was a preacher's kid. So, with that being said, through my teenage years, I started watching, and he and my mother was always so passionate about helping other people. And I'll tell you in a second how this translates into Medicare. But I remember when I was probably in my early 20s, this is before Ring Doorbell. I remember being like, there was a pastor that was having some financial issues with his, and he had a few children. And I remember thinking, what can I do to help that family? And I remember me and a couple of my girlfriends over to the grocery store, bought them some groceries. Like I said, this is before Ring Doorbell. And I went over to their house, put the groceries on the porch, rang the doorbell, and we all took off. And I remember that feeling that came over me like, oh my word, I just helped somebody. This is how I was raised. This is what I really want to do in life. So you might think, well, but how does that go to Medicare? Well, I didn't really realize that my passion was really helping people. So we'll talk a little bit more about that here in a minute and how it translates to Medicare, but it was built inside of me. I grew up with that passion, watching my parents help people. So one day, my husband and I were over at his parents' house. Now, this is where it's transitioning how I got so passionate about Medicare. So, my husband and I were over at his parents' house, And I had got into insurance prior. So I knew the insurance background and, or I had the insurance background, so to speak. So we're having dinner and his dad, who I always referred to as a quote seminar junkie, because he would go to all these different seminars, and he had retired from the federal government. He was 70 years old. So he was 70 years old. My mother-in-law was 67. So he had retired from the federal government and had retiree insurance. So he had but he had only signed up for Part A of Medicare, not Part B. So he said, "Hey, can you guys take a look at my insurance? Because all these seminars I go to, I'm given some different type of information." So we started looking, and of course, this is back when you had the CD, you had to put the DVD, CD in the computer and pop up all the benefits. So as we start looking through this and reviewing, that's when we discovered he nor my mother-in-law had signed up for Part B of Medicare. So it was very interesting to me because I'm like, well, why didn't you guys sign up for Part B of Medicare? And of course, I was not in the Medicare field at that time. And I sat there and I thought to myself, well, why didn't he do this? So thankfully, we were in what they called a guarantee or a general enrollment period. So he was able to go ahead and sign up for Medicare Part B, he and my mother-in-law. And as they signed up for Part B, we realized that every month that he and my mother-in-law had went without the Part B coverage, they had been accruing a late enrollment penalty. So thankfully, we was able to get the penalty stopped from accruing, but that penalty was a lifelong penalty. So today, they're almost 84 and almost 86. They are still paying that late enrollment penalty. So I sat there and I thought to myself, these guys are smart. How did this happen? And I realized it kind of sparked my passion. This is where I can help people. And that is really where my God-given mission comes in, to help and protect people. And my protection comes from, I want to protect you from falling in that same hole, so to speak, of having the late enrollment penalties because you're not really sure what you are doing. So that's where my passion really stems into the Medicare. So I'm going to go ahead and turn it over to Tisha and let Tisha tell you a little bit about herself. Tisha?
Oh, wow. That was great. So, a little bit about me before I came to Suzanne. I worked in the medical field for over 20 years. I've been married for almost 30 years. When I first started my career, I was working as a nurse's assistant in a skilled nursing facility and was assigned to a hall that had about 10 residents on it. We had a little lady down there that was bedbound. She may have weighed 70 pounds, but she didn't like to take a bath. For one, she was cold all the time. And for two, she didn't like water getting in her ears. Well, I was able to work down there with her and talk her into getting into the bath. We got in there. I fixed the water up for her, let her fill of it to make sure it was the right temperature for her. And we proceeded with the bath. Well, in the middle of the bath, I said, "Hey, let me wash your hair. It's been a while since it's been washed. I'll cover your ears to make sure that we don't get water in your ears." Well, she reluctantly let me do that, and we did it with success, thank the Lord. Well, after that, she didn't want anybody else to give her a bath because I had built a trust and a rapport with her. Although I no longer work in a medical facility, my passion is still the same. I want to make you feel comfortable so I can help you make the best Medicare decision. That's why I love it here at Numa, because it perfectly aligns with the mission to help and protect others. So I'm going to turn it back over to Suzanne, and we're going to start off with the JOY process. She's going to start off with the letter J.
Thank you, Tisha. Okay, so let's talk about J, in the JOY. So I always ask the question, isn't it easier to put a puzzle together with somebody that's already put a puzzle together before? Well, of course it is. So we've put this puzzle together many times, and we're absolutely here to help you put the puzzle together. So let's think of the J is a jigsaw puzzle. So if you're like me, when you open up a jigsaw puzzle, jigsaw puzzle, you kind of dump it upside down, you make sure all the pieces are flipped the right way, And of course, you want to start seeing what makes sense to start fitting them together. So each of these pieces are jigsaw puzzle pieces of information that we really need to have about you to make sure that we can complete your puzzle. So, okay, for example, here's some of the jigsaw puzzle pieces that we need to know. So we need to know who your doctors are. We need to know, do you have an employer plan? Are you on an employer plan with maybe a spouse? Or is there a spouse on your plan? Do you have children or grandchildren on your plan? How do you file your tax returns? Are you currently drawing Social Security? Do you have any pre-existing conditions? What are your prescriptions? What's your income? And again, do you travel? So every one of those jigsaw puzzle pieces, we have to have the answers to make sure we start creating this beautiful puzzle of giving you your joy back. And I like to say, like, has anything ever stole your joy before? Because as you can see, this can be a bit overwhelming, and I don't want this to steal your joy. So I'm going to help you keep your joy. Okay, so let's talk about, we're just going to kind of break it down, and let's talk about a few of these jigsaw puzzle pieces. So we do need to know how you file your taxes. So on our questionnaire that we send you, we ask you, what's your income? Because based on your income and how you file your taxes is what you have to pay when you enroll in Medicare Part B. Okay, so let's talk about, let me give you this slide, show you this example. So if you are 65 years old, just going on Medicare Part A and Part B, the way that it works is when you sign up for Medicare Part A and B, the government, Social Security, goes back and they pull your income tax return from 2 years prior. So right now we're in 2024. They're looking at your 2022 tax return. So if you, let's just say you have a joint filing, so husband and wife, joint filing, as long as you make less than $206,000, then you pay the base rate, which is $174.70. Now, as you can see, it is a sliding scale. So the higher your income, the more you pay for your Part B of Medicare. Now, these numbers are dictated by the federal government. They're the ones that say what the income brackets are and what the monthly fee is. Okay. Now, it is very important for the way that you file your taxes at 63 because it's going to affect you at 65 when you go on Medicare Part B. So let me give you a scenario here. So I had a couple come to me, and they were both turning 65, both going on Medicare Part A and Part B, and they were married, but they had filed a separate tax return 2 years before they turned 65. So at 63, they filed a separate filing. And you could see here, married, but filing a separate return. Well, they both made a little over $100,000. So as you can see here on the married and separate tax return, since they both made over the $100-some thousand, that threw them clear up here in this bracket of like around $559. Whereas if they would have filed a joint tax return and they were both over around, 200, or both over a little over 100,000, they would have been up there around the 206. So do you see how important it is to file your taxes at 63 and how it affects you at 65? So I hate being the bearer of bad news, but I told the clients, I said, well, here's what your Part B premium is going to cost you. Of course, they were very upset. And they're like, well, I didn't know that. Why would my accountant not told me that? And I simply said, I don't know why your accountant wouldn't have told you that, but have your accountant call me because I want to talk to your accountant. So the accountant called me. We had a great conversation, and we actually the accountant ended up refiling or amending their taxes, and even like amending them, paying the taxes, and even paying his fee for the refiling. They still end up saving several $1,000s. So it is very important for the way that you file your tax returns and how it will affect you when you go on Medicare Part B. Now, the next thing we're going to talk about is HSA, which is Health Savings Account. So this is another piece of the jigsaw puzzle. So basically, the way that your HSA works is if you are still working and you have an HSA, if you enroll in Medicare Part A or Part A and Part B, and you're the employee, you're the main person on that insurance, then you can no longer contribute to your HSA. With that being said, there are caveats based on if you have the spouse being the primary person on the insurance. So, but as a general rule, you cannot enroll in any form of Medicare and contribute to an HSA, but there are a few exceptions, and we will definitely discuss this if you fall into that category. So, what are some other pieces of that jigsaw puzzle? As you can see, I need to know, are you drawing Social Security? Because if you're drawing Social Security and you sign up for Part A and B, the Social Security is, the Part B is taken directly out of your Social Security check. So these are pieces of the jigsaw that changes. So you might tell me, well, these are my 5 doctors this year. Well, next year they might be 3 different doctors because maybe they've retired or you've moved to different doctors. So these are definitely jigsaw puzzle pieces that change. So I'm going to go ahead and turn it over to Tisha, and she's going to talk about the O in the JOY process. Tisha?
All right. So the O in the JOY process represents the outline of your options. Then we're going to fill in the outline to see what makes the most sense for you. So let's talk about Medicare Part A and B for a minute. So Medicare Parts A and B are the only 2 pieces that come from the federal government. Everything else that goes with A and B comes from private insurance carriers. Part A covers your inpatient care. So that's your hospital stays, home health care services, hospice care. It does cover skilled nursing facilities, but that would only be for a temporary stay. For instance, if you had to be admitted to skilled nursing for physical therapy after some type of surgery or something like that. Otherwise, Medicare does not cover long-term care or custodial care in a medical facility or a skilled nursing facility. Then you have Part B that covers your outpatient services. So that's your doctor's visits, ambulance services, durable medical equipment. It also covers limited outpatient prescription medications. Those are also known as Part B as in boy drugs. That's for things like if you have to go have IV infusion at a medical facility or maybe some type of injections at a doctor's office. Otherwise, Medicare does not cover prescription medications that you pick up at the pharmacy. That's why you have to have a drug plan. Now, if you just had Medicare Part A and B and nothing else to go with it, you would be responsible for the Part A coinsurance and deductibles. And then Part B has an annual deductible. And once that's met, the coverage is 80/20. So we're very visual people here. We like to look at Medicare Parts A and B like a piece of Swiss cheese because there's lots of holes in it, right? Leaves you owing the coinsurance and the deductibles. What you come to us for is to cover those holes in Medicare. And you basically have 2 choices. You have a Medicare supplement plan, also known as a Medigap. They are exactly the same thing. And then you have Medicare Advantage plans. So the first one that we're going to talk about is the Medicare supplement plan. Now, with the Medicare supplement plan, when you're aging into Medicare or you're coming off of a group plan, you're what is known as a guaranteed issue in a supplement plan. Guaranteed issue means that the supplement has to accept you no matter the health issues you have or don't have, no questions asked. With a supplement plan, you can go anywhere in the United States that accepts Medicare. So if you call a doctor's office or a medical facility and ask them if they take Medicare and they say yes, they have to take your supplement plan behind it. That's the law. Now, Medicare supplement plans always piggyback traditional Medicare Parts A and B. So the way it works is you go to the doctor's office or you get admitted to the hospital. That facility is going to bill Medicare first. So they're billing the government. And then they would turn around and bill your supplement plan behind it. Since the supplement always piggybacks Medicare, as long as Medicare covers the service, your supplement will cover the service. If Medicare doesn't cover the service, your supplement will not cover it either. Now, there are a few things that Medicare does not cover. I'm going to name a few of them, such as dental, vision, and hearing. Now, with that being said, Medicare will cover things like diseases of the eye. So cataracts, glaucoma, diabetic retinopathy, things like that. Medicare's just not going to pay for your routine eye exam to get glasses. Now, with Medicare supplement plans, there's actually several different plans to choose from, plans all the way from A to N. But the one that makes the most sense for everyone right now is a Plan G. So here's what Plan G is going to cover. Plan G will cover the Part A coinsurance and deductibles, and it's going to cover the Part B coinsurance, but not the Part B annual deductible, which is $240 this year. So what that means for you is once you've met your $240 deductible for the year, then you have 100% coverage on all Medicare covered services after that. Now, we're going to move right on to the cost of a supplement plan is based on your age, your gender, where you live, which carrier you choose. Rates do go up annually, just like with any other insurance. Now, to go along with the Medicare supplement plan, if you go that route, you must also purchase a standalone prescription drug plan because Medicare supplements typically do not provide coverage for most outpatient medications. So what we would do is we would take a look at your medications. That's one of those jigsaw puzzle pieces that we like to bring in the mix. So we want to make sure that those are accurate so we can give you an accurate quote based on your current medications. So that's Medicare supplement and prescription drug plan. Now let's move on to the other choice, which is Medicare Advantage plans. Now with Medicare Advantage plans, you still have to have Medicare Parts A and B. You still have to pay your Part B premium, but they work totally different. So basically what the government did with these plans is they said, we're going to give all these private insurance carriers an allotted amount of money to take care of everything. So they take care of the billing, the managed care, the whole ball of wax, basically, if you will. So with Medicare Advantage plans, a lot of the ads that you see on TV about calling, you can get free this and free that and get what you're entitled to. Those are advertisements for Medicare Advantage plans. So with Advantage plans, they are low to $0 monthly premium. They combine your Part A for hospital benefits. They combine Part B for your outpatient medical coverage. And they combine the Part D drug benefits all into one plan. So you don't have to purchase a separate drug plan. Now, to go along with Medicare Advantage plans, you are subject to being a network of providers. So you have two networks. You have HMO and PPO. With an HMO, it's a very strict network that you must stay in. If you go outside of the network for anything other than an emergency, you're responsible for 100% of the cost. On a PPO plan, it allows you to go in and out of network. Now, you're always going to get your lower costs by staying inside the network, but you still have coverage if you go outside. You're just going to pay more for it. And then also with Medicare Advantage plans, you're going to have a maximum out of pocket that can range anywhere from $3,500 to over $10,000. So the way that they work is you have set copays for everything that you do. You may pay $5 to go see your primary care doctor, $100 for an x-ray, so on and so forth. All of those copays that you pay go towards that maximum out of pocket. Now, also with Medicare Advantage plans, they do have ancillary benefits built in for dental, vision, and hearing. And with Advantage plans, certain services and procedures do require a prior authorization before you could have that done. Now, there's really not a wrong or right answer whether you choose Medicare Supplement or Medicare Advantage. What we do is we educate people on both types of plans and let you make that decision for your life. but we want to make sure that you understand the rules. So we look at it like a ladder. At the top of the ladder, you have your Medicare supplement plan because that's the most comprehensive coverage you can get. You're going to pay a monthly premium for it. You can go anywhere in the US that accepts Medicare. And basically, your maximum out of pocket is going to be that Part B annual deductible, which is $240 this year. Then a little further down on the ladder, you have your Medicare Advantage plans. Those are low to $0 premium. You have to stay inside of a network of doctors and facilities, and you're going to have a high maximum out of pocket that can range anywhere from $3,500 to over $10,000. So if you enroll into a Medicare supplement plan first, you can move down the ladder to a Medicare Advantage plan anytime during open enrollment, which is October the 15th through December 7th. No questions asked. However, if you enrolled into a Medicare Advantage plan first, and a couple of years later you called me and said, well, I got to have knee surgery. I think I'd rather have the more comprehensive coverage. What I would tell you is we can shop those plans, but now you're no longer guaranteed issue. So that means you're going to be subject to medical underwriting. They're going to ask you health questions, pull your medical records, and chances are you could get denied, or they could come back and say, yes, we'll take you, but your premium's going to be super high. So let's just summarize Medicare supplement versus Advantage. So with Medicare supplement, Medicare pays first, your supplement pays second. All the billing is done behind the scenes, and you're basically going to get a bill for the Part B deductible. You're going to have a premium between $110 and $200. You have to buy a separate drug plan, but you can go to any doctor, hospital, or facility that takes Medicare. For Medicare Advantage, you still have to have Medicare Parts A and B. You're going to have copays and deductibles to pay. Many of the premiums are $0 and they have the drug plan included, but they also have that liability out of pocket that can range from over $3,000 to over $10,000, and you have to stay in network to get the best deal for your dollar. So I'm going to turn it back over to Suzanne, and she's going to go over the why of the JOY process. Suzanne?
Wow, Tisha, that's a lot of information. So let's talk about the why, because as you can see, JOY. So we're giving you the joy right back in the process of Medicare. So let's talk about the why. And what we would look at that is your yearly reviews. All right, so let's talk about the yearly reviews. Here is why you need the yearly reviews. Because on the prescription drug plans, your formulary can change. What a formulary is the list of medications that the insurance company can choose to cover. So for example, a couple of years ago, one of our insurance companies came out and they said, everybody that's on Eliquis, we're dropping that drug. Now, all of you know Eliquis is a very expensive blood thinner. So every client that was on that particular plan, when we did the yearly review for them, we had to change their plan because their current plan was no longer going to cover Eliquis. So I had to shift them over to another insurance company. So formulary change absolutely can happen. These plans the drug plans run January 1 to December 31. So that's why we recommend the review, the yearly reviews, because of the formulary change. Another reason why we should have the yearly review is your tier change. Let me explain how this works. So typically your medications are kind of broke down in levels. Tier 1, Tier 2, Tier 3, Tier 4. Generally, the lowest tier, so Tier 1, is typically your cheapest medication, like a preferred generic. And then it goes to generic, and then it goes to a preferred brand. The higher the drug costs, typically, the higher the tier. Well, an insurance company, when they rebid, put their plans out for rebid, they can come back and say, well, you was paying for a Tier 2 drug, but next year we're going to bump that same drug to a Tier 3 drug, which means if you go to the pharmacy, it potentially can be a completely different cost because the insurance company pushed that drug to a different tier. Another one, preferred pharmacy change. I have this crazy story about this. So I was doing this review for one of my clients, and it was funny because he said to me, Suzanne, I love my plan. I love my meds. Everything is working perfectly, and I really don't want to do nothing. But we decided to do the review. So as I was doing the review of his plan, it was very interesting because the pharmacy he went to was a preferred pharmacy for that particular year. But the next year, that particular pharmacy fell out of the network as a preferred pharmacy. So as I was doing his review, I said to him, well, I guess let me ask you a question. This is not a preferred pharmacy for next year. Would you go across the street to this pharmacy? Because if so, it's going to save you $1,600. So literally, we did not change his plan. We did not change his medications. All we did was he went from the pharmacy he was currently using to a pharmacy right across the street, and it saved him $1,600. I jokingly said to him, was this review worth $1,600? Because he saved $1,600 because he didn't know that plan was going to, pharmacy was going to go out of the preferred pharmacy status. Another reason for the yearly review is the annual deductibles. So every single year, does not fail, someone will call me in January or February, and they'll say, hey, Suzanne, I just got to the pharmacy and they're charging me this big high amount for my prescription drugs. And that's not what I paid back in December. Sure enough, the year started back over and the deductible started back over. So every year, if you have a deductible on the pharmacy plan, Part D, that deductible starts back over January 1st. Another reason, on the Medicare Advantage plans, just as Tisha explained, they have typically their network plans. You have your HMO that's in network, or you have your PPO that has in-network benefits, but you can go outside of the network. It just might cost you more money. So here last year, one of our big hospital systems decided to not recontract with 2 insurance companies. So 2 of our very large insurance companies was not able to recontract with this hospital. So what that meant is every single client that was on that particular insurance, those 2 companies, their Medicare Advantage could no longer use that hospital facility unless it was an emergency or because it was not in network. So during the yearly reviews, if a hospital or a doctor or hospital system falls out of the network or they don't come to an agreement for next year, we're able to catch that during the reviews and say, either you need to make a plan change to a Medicare Advantage plan that covers those hospital or doctor facilities, or you need to change doctors. So those are the reasons why these yearly reviews are so important. Okay, so let's kind of just talk about the elephant in the room. So a lot of people say, well, how do you guys get paid? So I'm just going to give you some misconceptions versus the truth. So I'm just going to read them to you. Here's the misconception. This is the common misconception. Numa will receive a commission starting now and every year as long as I'm on a plan that you help me enroll. This is more than enough to compensate Numa to take care of me in the future. That's the common misconception. Here's the truth. Some Medicare plans drop the commission to almost nothing after a few years. Some of the RX plans do not even pay a commission at all. It's so awkward to talk about it, but this is so important for you to know. So I know what we do when we do the reviews for you each year. If an insurance company comes up that we cannot sell, or they don't contract with advisors, but it is definitely the right plan for you, we'll call you and say, hey, we cannot sell this product because maybe the insurance company doesn't contract with us, but this is the best thing for you. You need to call this insurance company directly and sign up if that's definitely the one that's best for you. Another misconception. Agents who advise on different Medicare plans represent all companies, and all plans are unbiased. They always do what's best for the client and they do it all for free. Here's the truth. Yes, they may do it without charging a fee, but many agents steer or guide clients to certain plans that pay a higher commission. So let me tell you this story. So last year at open enrollment, I was doing a review with a client, and she said to me, "Hey, Suzanne, I saw this ad on television and it showed a Medicare card, and it said, if you want free dental, free vision, or free hearing, and you have Medicare, call this 1-800 number." So she called the 1-800 number. Unfortunately, she thought it was Medicare, which it was not. It was a call center. And while she was on the phone with that agent, they enrolled her in a plan. They never asked her who her doctors were. They never asked her her prescription drugs. And then she called me and she's like, "I think I messed up because that agent or that advisor through that call center did not do their homework and did not get all of her information to make sure that they were making the best decision for her." I think Tisha may have had a story about this too. Tisha?
Yes. So I had a lady call me a couple of weeks ago, and she had went to the dentist office and was planning on getting several crowns put on, and it was going to cost her several $1,000s basically. Well, while she was at the dentist office, they made mention of a couple of plans that she might want to check out to get those crowns covered for her. One of them was an Advantage plan, and then she thought that the other one was just a standalone dental plan. So we talked about the Advantage plan first, and then she really wasn't interested in that. And so she decided that she was going to call that carrier, which she thought was just a standalone dental plan, to find out how much it would cost her for the crowns if she went on it. Well, come to find out, it was an Advantage plan, and the agent that she talked to, he did look up her doctors. And so she sent me an email and said, "Hey, it's an Advantage plan. He looked up all my doctors. They're in network. Do you think this is a good plan?" And so my response was, "Did he look up your medications? Because we have her medications on file. We know what she takes." And she sent me a message back and she said, "Oh, no, he didn't do that. That's probably not a good idea then, right?" I said, "Well, it's up to you, but we definitely want to make sure that all your bases are covered before you make this decision to go on this plan." And she just responded, and she called me on the phone and she was like, "I just love you guys. Y'all are so wonderful. I would never change any plans until I call and talk to you first because I trust your advice."
Okay, that was a great story. When Tisha told me that, I was like, oh, I just can't believe that this kind of stuff happens. So here's another misconception. After I get on the right plan, I really don't need an advisor to help me in the future. And Tisha gets this question so often. So I'm gonna let Tisha answer this.
So, yeah, most of the time I get this question about, well, why would I need a review this year when I'm just signing up on a plan? Well, one thing I want you to remember is the plan that you sign up on today is for the current year that we're in. Just like Suzanne talked about earlier about why you should have a yearly review, because the drug tier changes, the annual deductible can change, the preferred pharmacy, all of these things. So you may be on some expensive medications this year, and you love the drug plan that you're on, and you're like, "I'm good. I don't think I need to do anything." But then if we didn't do a review and you went to the pharmacy next year, maybe in January, maybe you find out that that expensive med that you're on was no longer covered. And so then that puts you in a pretty hard spot to have to pay a lot of money out of pocket for a medication that would have been covered if we would have done a review for you.
So as you can see, there are many common misconceptions versus the truth. And we here at Numa, we are committed to being unbiased, always giving you the best advice, regardless of the commissions paid. So we're going to talk a little bit here about a program we have in our office here called Extra Care. Now, our extra care covers the yearly reviews. So I'm going to just kind of break down the extra care benefits. So one of the extra care benefits is you've got to go through the Medicare JOY process. You also get unlimited email support, unlimited phone support. Your yearly review is absolutely part of this extra care membership. We'll email you, we'll call you, we'll text you, we'll mail you a newsletter that says, hey, open enrollment is coming. If you want us to review your plan, here is the time for you to review it, and here is our process. And then we'll start the open enrollment review. Now, last year, we was able during the open enrollment period to save our clients $999,000. Now, I was hoping for $1 million. We didn't get there, but $999,000. That money went back in your pocket, the client's pocket. It didn't go to the insurance company. It did not go to the pharmacy. It did not go to me. It went into your pocket. So, like, for example, my client that I told him to go to the different pharmacy. So when I did that review and I said, hey, it'll save you $1,600, that $1,600 went into this equation because during the open enrollment period was the time that we caught that we discovered that he needed to change pharmacies. And if we wouldn't have done the review, he would have never known to change the pharmacies because he didn't understand. So needless to say, the open enrollment review, absolutely pertinent, very important, saved our clients $999,000. Once again, I told you I'm kind of annoying the month of September because I'm saying, let's request your review because every year plans change and we want to review your plans. You get unlimited priority phone and email support. So when you call into our office, you'll dial a specific prompt that says, hey, I'm an extra care member and I'm paying extra money. So you will definitely get unlimited phone support, priority. You also get access to our secure online document where you can enter in, it's a client portal. You can update your medications, your pharmacy, your doctors, hospitals, things like that. Also, you get to join a monthly live cast with me. And basically, I do it pretty much every month during the end of the year, during open enrollment season. Sometimes we have to skip a month or so, just depending on workload. But it's a live cast each month where I invite you to a Zoom and I bring out very important information to you to let you know every single month we're working on your behalf. We are here supporting you in every way we can. We're bringing you up to speed with things that are very important to you, changes, things that are valuable to you. Now, we also have a billing concierge team. So this is probably one of the biggest things that we have clients utilize other than the yearly reviews is, so you know how you get so much junk mail? So you get junk mail, you get these explanation of benefits, you get the letters from Medicare, and then you got all these things that look official, but you're not even sure if they're official. So with our billing concierge team, anytime you get anything that you don't understand, all you do is take a picture of it, text it, email it to us, mail it to us. If it's a bill that you look at and you're like, this bill does not look right, all you do is send it to us, and our professional eyes can look at those and be like, yeah, something doesn't look right. So let me tell you the story. I had a gentleman probably about 6 months ago, and his wife had passed away. And he was getting, and I call it hate mail, but he was getting all this mail from like these doctors' offices, facilities. And of course, it's all computer generated letters, basically saying, if you don't pay this, we're going to turn you into collections. Well, he was in the process of dealing with his wife passing away, and he was getting all this mail. He called our office and he's like, I just don't know what to do. I have so much mail with all these bills and I'm getting turned into collections. And we were able to take all of those bills, contact each facility, and really all it was is they didn't have the insurance on file correctly. We was able to correct all of those bills, hospital bills, doctor bills, lab bills, and sure enough, all of it got covered 100% because that's what his plan was. So that was just one example. We have story after story where clients, got a bill, wasn't sure if the bill was accurate, went to pay it, and then remembered, hey, we have this service. They called our office, they sent it to us. We was able to go. Now, here's the thing. If the bill is accurate and you owe the money, you got to pay it. But basically, you have our professional eye that's here to walk you through to make sure that you do not pay something that you don't owe. So that's our billing concierge. Now, one of our other things that we have here that you will get as an extra care member is our Legacy of Love kit. Let me explain this Legacy of Love kit. So last April, we got a phone call from a client, and she was very, very distraught. And she said, my husband passed away unexpectedly. I wasn't prepared, but he handled all the bills. He handled all of our health insurance. He handled everything. I don't even know his password to his computer. And she had been on the phone with Apple trying to reset the password. And the reset password was going into his email that was in his locked computer. So, of course, we felt terrible for her. So we got off the phone with her, and we, like, as a team got together. We're like, what can we do? Because this has happened to more than one of our clients. What can we do to help and protect our clients? Because that's our God-given mission. Help and protect as life gets complicated. So we created a Legacy of Love kit. The Legacy of Love kit is a 3-ring binder, and you get this as an extra care member. And as you go through the 3-ring binder, it has sections in it for you to fill out for whoever you leave behind. And it has all of your passwords. It has all of your passwords, your logins, even who your insurance agents are, car insurance, auto, homeowners insurance, life insurance, where your annuities are, where's your 401k, who's the contact person. It has all of that all in one place, and you will get this 3-ring binder mailed to you. And, funny story, as we were doing it, okay, I have a dog, and I even put a section back here in the back for pets, because I thought to myself, well, if something happens to me and my husband, my kids need to know where to take that dog to get his shots. So I even have a pet section in the back. And you, as an extra care member, will get this in the mail sent out to you. So the cost of the extra care is $199 a year per person, or $19.99 a month. Either way. When we did it, we tried to make it as cheap as a pizza. So that's a little bit about our program here. And we definitely look forward to working with you and can't wait to talk to you. Thanks again.